Hi, I'm Dr. Danielle Mark Collins, Clinical Director of DermaFace MD Skincare and also Clinical Medical Director of DermaFace Skin Clinic since 2009, would you believe? So today I am just doing a part 3 on smokers' lines. We got really into the reasons and the cause of them. And again, just to quickly caption on that, there are 3 main people who will get smokers' lines: people who smoke or vape, people who have never smoked or vaped, also people who are obviously people who used to smoke or vape and then have stopped. There's also a 4th category. If you're a Botox Karen and you're going around any type of Karen or any type of Botox Ken with his Mantox going around all cross and grumpy, that can also cause smokers' lines. So we discussed having some filler along the vermilion border, some derma filler along the vermilion border, because that almost battens down the hatches and that will stop. It's almost like I guess like in the old cowboy movies, you know, when they batten down the door, it'll just stop it getting worse. Then the next thing to do is obviously make sure you go to a good injector. And I want to give this information to patients so that they have the questions, they can ask the questions, ascertain if the injector is good enough, because this is a tricky thing to do. So the first thing to do is obviously inject the filler and have the filler injected along the vermilion border, which is where the pink meets the, in my case, white skin, okay? So the next thing is then obviously you don't have filler in the Cupid's bow, that's like 10 million seasons ago. Then the next thing to do is to wait 3 or 4 minutes, because then the product will actually numb the area. Slightly more painful again is to have filler up, again, everything up. So you can have filler injected up into the tiny little, there's always a few little smokers' lines that are crossing over the vermilion border, which is where the pink meets, like I said, in my case, white skin. So inject them up, but again, have along here done first, because then it's numb. That's the top trick. Always make it as comfortable for the patients as you can. When I'm injecting lip filler, I tend to be able to catch a break here and then it just shoots up the whole tube there, and then the same on the other side, and then you're just doing 2 injections. It goes the whole way up and you massage it up. Again, if there's scar tissue, that won't happen. And again, that didn't happen for me till I was 4 or 5 years into injecting. It's kind of experience more than anything. So then you've got the vermilion border done, and then you've injected up into these areas, just a few. You can go kind of high up here as well, but again, you've got to massage, really massage. And when you're massaging, your clinician will use some sort of a slip, so some sort of a product that will massage it in, like not a moisturizer, maybe a more medical type of product. I don't want to promote anyone here. And then have a sprinkling of Botox, so maybe a 1/4 unit here, a half unit, half unit, half unit, half unit, half unit. I definitely have the, as Ed Sheeran says, the 10,000 hour rule. So a lot of this is intuitive to me. So again, a 1/4 unit, quarter, half, maybe zigzaggy. Get the patient to purse their lips, and then you'll see where the insertion of the muscles is pulling, and you want to kind of deactivate those a little bit. But you've got to be careful as well. You don't want droopy mouths or anything else like that. So that is part 3 for smokers' line. So good luck. And the main thing is don't smoke. I sound like an old nag, but don't smoke. And you're so precious and you're so wonderful and you're so beautiful. All of you, just mind yourselves and just don't smoke, okay? That's